practice for using yoga for pelvic floor health. So before we begin, I want to just discuss the pelvic floor so that we all are aware of this area. I remember going to my first yoga class and the yoga instructor said, lift up on your pelvic floor. And I thought to myself, well, where is that? So if you're like I was and you want to have a little more awareness of this area, let me first start by saying that the pelvic floor is the southernmost tip of your torso and is bordered on the north by the pubic bone, on the south by the rectum, and its east-west borders are your two sits bones. And the purpose of the pelvic floor is to support all of the organs of the abdomen. That includes your bladder, your rectum, and where applicable, either your uterus or your prostate. So this is the area that we are speaking about. And yoga is the perfect tool to use for pelvic floor health because yoga is constantly asking you to evaluate how you're being in your body and just bringing an awareness to how you're moving throughout this life and what is impacting your health. So what I want us to first start off by doing is just trying to bring an awareness to this area. So come to a comfortable seated position and make sure you have some blocks, two preferably, and some blankets. I have my yoga blankets here. I have two. You can go and get two household blankets and fold them. We'll be using those to find a comfortable seated position. So please grab those items, and I'll use my blankets to sit on. And make sure you're comfortable above all else. You can have your ankles crossed. Okay. And so what I want us to first do is make sure that your knees are lower than your hips, because what that will allow you to do is it will allow the pelvis to be neutral. It will support the natural curves of the spine, and it will allow you to take a much deeper, long-lasting breath. That's what the neutral pelvis position does for you, okay? So take a long breath in and a long breath out. And deep breath in, deep breath out. One more time, inhale and exhale. Keep breathing. And what I want you to know is that your pelvis mimics the motion of the respiratory diaphragm. So the diaphragm sits up higher, pelvis sits lower. When you inhale, what happens is the diaphragm pushes down and it causes the pelvic floor to release and lengthen. And when you exhale, what happens is the diaphragm as well as the pelvis lifts and rises and it contracts. And that's just normal breathing without you putting any extra effort whatsoever. So inhale, drops and release. Exhale, lifts up and contracts. So envision that, embody that. Inhale, pelvic floor drops and release. Exhale, lifts and contracts. One more time. Inhale, think of it lengthening and releasing. Exhale, think of it lifting and contracting. Place your hands on your knees. And so another thing what I would like us to do, just to bring a little more awareness to this area, is practice your Kegels right now. So whatever you have in mind or whatever you think a Kegel is, perform that action right now. And then let it go. Notice what muscles activated. Which muscles initiated that action? Was it your rectum? Was it your abdomen? So one more time, perform your Kegel and release. So many women were taught that a Kegel is just squeezing in, squeezing in. That's only half of the truth. What you want to do is you want to squeeze in and lift up. So first, squeeze your rectum, squeeze your glutes together. Let that go. See what that feels like. Squeeze it together and let it go. Now, try to cut off your urine stream. So what you're going to do is squeeze, try to cut off the urine stream, let it go. Squeeze, try to cut off your urine stream as if you were urinating, and then let it go. So now, the muscles of the pelvis are a lot smaller, much smaller than the glutes. And to get them to activate, the motion is a lot more subtle. So we want those glutes to remain soft and quiet. They're like those older bossy sisters that always try to get in and just take control. But tell those glutes to chill out, to relax. We got this, all right? So what I want you to do is imagine you bringing your navel in and lifting it up to your crown of your head. Hold it and release it. So inhale, stay as you are. Exhale, navel in and up to the crown of your head. Now release. One more time. Inhale as you are, relax. Exhale, bring the navel in and up to the crown of your head with the glutes remaining soft and quiet. Now release. So we're going to work on releasing the pelvic floor as well as doing some exercises or some yoga poses to actually strengthen the pelvic floor. And some issues or some complications that people may experience is stress continence or urge incontinence. Stress incontinence is anytime when you exercise and you may experience some leakage, or urge incontinence is if you're constantly feeling that you have to go to the bathroom, and then when you get there, you urinate for maybe 3 seconds. Your bladder is able to contain, to hold 2 cups of urine. And a full bladder is recognized when you go to the bathroom and your urine stream lasts at least 10 seconds. If you're going to the bathroom every 10 minutes, every hour, and your urine stream is lasting less than that 10 seconds, you may be going too frequently, and I urge you to contact a healthcare provider, okay? So now that we know the area that we're talking about, what I want you to do is come to your tabletop position. We're going to practice a couple of cat-cow postures. Move your blocks to the front of your mat to have them there. Stack your shoulders over your wrists, your hips over your knees, and separate your knees about the width of your hips, okay? So inhale, lift the tail and head up. Your pelvic floor muscles are lengthening here and relaxing. Exhale, roll through the spine, drop the head, drop the tail. And when you exhale, remember the pelvic floor is lifting and contracting for your cat. Inhale for cow, lengthening and expansion. Exhale, drop for cat, lifting and contracting. Inhale, cow, lengthening and expanding for your cow. Exhale, cat, lifting up and contracting. A couple of more of these on your own. Inhale and exhale. Visualize that, embody that. Inhale, lengthening and widening. Exhale, lifting in and up, contracting. Come to a neutral spine. Let's do some tail wagging. Tail wagging is awesome because sometimes there are disparities between the right and left side of the pelvic floor. And what this does, it gets inside each of the 2 sides of the pelvic floor to provide some release. So shift your hips over to your right. And as you do so, just bring your attention to the pelvis and how you're feeling at this particular time with this movement. Come over to your left. Just wag your tail. Go nice and slow. Like the dogs out there when they just do like this and they shake and they get excited. That's not what we're doing. We are moving with purpose and intention from left to right. Over to your right, and the left side lengthens and expands. Come over to the left, 2 seconds, hold. Come over to the left. Stay for 2 seconds and hold. Now, you may notice as you go from each side, you may be feeling a little sensitivity, more so on one side than the other. And if that's the case, stay a little bit longer on the side in which you feel some discomfort in, okay? That means that you may need a little more lengthening on that side. It might be a little tight inside that area, okay? Come back to your neutral spine here. Now let's do some what I would call circle motions, stirring the pot, or what I like to say is buttering an English muffin, because you're getting inside all those little nooks and crannies with the butter and with the knife. So start neutral spine, neutral pelvis, neutral neck. Shift your hips over to the right, drop them down by the heels and come up to the left. Making circles, shift to the right, drop them down by the heels, coming up to the left. Remember, you're getting inside all those little nooks and crannies. And with this motion, what we're doing, it's kind of like a hula hoop. What we're actually doing is we're lengthening as well as doing some strengthening when we contract as we tuck and come up. Lengthen as we go to the sides, dropping down, and as we come up, the tail is tucking a little bit and the pelvis is strengthening here. Pause here at the top. Now reverse. Shift your hips over to the left, drop them down by the heels, coming up to the right. And as you go through this, as you do your hula hoops, pay attention to how you're feeling, how you are experiencing this movement and what signals your body may be speaking to you. All right, sometimes we move and we may ignore that cramp and we just power through. That's not yoga. It's all about the knowing and the experiencing and the observation. Pause at the top of your mat. Inhale for your cow. Exhale for your cat. Step your right foot forward in between the hands. Grab hold of your blocks, maybe bring them a little bit closer. I want this front knee to be right on top of the ankle. And I want your pelvis to be neutral, so not too far out, not too far in. We're just going to stay here, neutral pelvis for a moment, and breathe in. Breathe out. Breathe in. And breathe out. Remember, inhale, pelvic floor drops and releases. Exhale, pelvic floor lifts and contracts without any extra effort, So what I want you to do is we're going to do some pelvic tilts here. Inhale, lift the head and tailbone any amount. It may not lift too much here. Exhale, curve everything in, curl everything in. Inhale, cow spine, look up. Exhale, curl in. Inhale, lift up, expand. Exhale, curl in. I want you to really push through the heel of the front foot. It'll activate that glute a little more. And just pause. So when you do that, when you press through the heel and you feel that right glute activate, that's great because the glutes also support the pelvic floor. We just don't want it taking over and bossing it, but it can help support. All right, bring your right knee back down to the earth. Move the blocks out of the way. Give me one set. Inhale for cow. Exhale for cat. Lift your left foot forward in between the hands. Grab those blocks again. Remember the important location of the knee over the front ankle, and just pause here. Inhale, 3 breaths. Exhale. Inhale. And exhale. One more time. Inhale. And exhale. This time we'll start with the cow pose. Inhale, stay as you are. Exhale, round in, tuck everything in as that pelvic floor lifts and contracts. Inhale, lift up, it widens and expands. relax for your cow spine. Inhale. Cow, excuse me, last one was cat. Exhale, cat spine. Inhale, cow. Exhale, cat. Return the hands and knees back to the earth. Move your blocks out of the way. And let me just make sure my wardrobe is appropriate for down dog. I don't want my guts coming all out. All right. Tuck your toes under, lift your knees, straighten your legs, downward facing dog. So in down dog, you're in an upside down V position. Bend one knee at a time. Maybe take your dog for a little walk. Any little movement here that you feel you need. And when you're done, find some stillness. Press through all 10 fingertips. Push the floor away. Don't sink your chest into the mat. Now bend your knees. And as you bend your knees, lift the hips up to heavens even more. And what we're doing here is we're lengthening, we're releasing that pelvic floor. Feel the expansion here. Press the floor away. Breathe in and breathe out. 3 rounds of breath. Breathe in and breathe out. One more time. Breathe in and breathe out. Straighten the legs, sink the heels down to the floor. Pause. We'll do that one more time. Bend the knees. Push the floor away with the 10 fingertips. Now slowly lift the hips up to the heavens. And I have to remind myself, don't sink the chest into the mat. Breathe in and breathe out. Breathe in and breathe out. One more time. Breathe in and breathe out. Straighten the knees. Release your heels down to the mat. Now step your right foot forward in between the hands. Come up to your warrior 2 position. We were releasing and lengthening. Now we're going to work on strengthening. So in warrior 2, this front knee is stacked right on top of the front ankle. And I want you to shift the bottom of the flesh of your buttocks down. Press through the heels of both feet. That way your back leg takes some of this and it's not all dumped into the front knee for your warrior. Feel the pelvic floor here. Inhale. Exhale. Inhale. Exhale. Cartwheel the hands down to the mat and step back, downward facing dog. Bend your knees, shift your hips up to the ceiling. Feel that nice expansion of the pelvic floor and a release of that. Straighten the legs, heels to the mat. Now step your left foot forward in between your hands. Come up to warrior 2. Remember this knee position. Get your bearings, set yourself up for success. Shoulder, arms at shoulder height. Now look at my pelvis. You see it's tilting forward, dumping all of my goodies onto my front thigh. What I want to do is shift my butt down to the floor. Press through the heel of both feet. And then arms up. Breathe in. And breathe out. Breathe in. And breathe out. Cartwheel the hands down to the mat. Step back. Downward facing dog. Inhale. And exhale. Bend the knees. Lift those hips up to the sky. Wag your tail. Drop your knees down to the earth. Sink your hips back by your heels. Child's pose. Now, if you have been blessed by the breast goddess, separate your knees and allow your torso to sink in between those knees. Even in this pose, in child's pose, feel the expansion, the widening of the pelvic floor. Breathe in and breathe out. Breathe in and breathe out. Take a long, full breath in. Long, full breath out. Come back up to seated. Comfortable seated position. You can use your blankets if you need to. And so now what I want you to do is, let's go back to our first pose. Travel back to where we began and just close your eyes for a second. Bring your awareness down to the pelvic floor region. Bring your awareness back to your breath. Is your breath a little smoother than when we began? Is it a little bit longer than when we began? And are you feeling a little more relaxed, a little more at ease, at peace? Inhale, pelvic floor and diaphragm drops and release. Exhale, lifts up, contracts. Inhale, drops, release, relax. Exhale, lift in and up, contract. Inhale and exhale. 2 more times. Inhale and exhale. Release your hands down to your knees. Sit up nice and straight. Pause. Bring your knees together. Come to your back. Bend your knees, feet flat on the floor. Bring your knees into your chest. Separate your knees. And just rock and roll from side to side. Some people love this, especially if they have tight pelvic floor muscles. The expansion is just awesome. You want to first learn how to release the pelvic floor, then you can work on strengthening it. Some people think that they have weak pelvic floor muscles, and it could be that your pelvic floor muscles are too tight because we do a lot of gripping and guarding. This area, it's like a container, and it holds so much of our emotions and past trauma. So anytime as you move through life, be it driving and you're stuck in traffic and you get angry, or you may be late, or standing at the kitchen sink washing dishes, and your son or your daughter comes giving you grief, I notice that I tend to do a lot of guarding of and tightening of this area. Nice. So bring your knees together, feet plant down on the floor. We're going to get set up for Shavasana. So you can have your legs out in front of you. Arms at your side, palms up to receive love. Or you can bring the soles of your feet together, Supta Baddha Konasana. Whatever is going to give you more ease and peace. Bring your knees into your chest, roll over onto your left side. Use your top hand, your right hand to press up to a comfortable seated position. Keeping your eyes closed, bring your palms to your chest. To love. Bow down to your ground as I bow down to the 8 in each and every one of you. Thank you so much for showing up. This concludes our practice. Again, my name is Tina Terry. Peace.